Okay then, I'm going to make a start with the meeting now. Okay, welcome to today's meeting. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note, this meeting is recorded and streamed live. These recordings are published on the relevant meeting page on the Council's website. By choosing to attend this public meeting, you are deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you've left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. Okay, so that first bit of housekeeping done. Councillor Lynn Denham is away today, so on that basis, as Vice Chairman of this particular committee, I will be chairing it tonight. So Julian, can we have the appointment of substitutes, please?
Thank you, Chair. Yeah, we've got 3 substitutes. So Jabari is here for Lynn Denham, as you mentioned. She's given her apologies. Sorry, I should have said 4 substitutes, not 3. Yeah, Jabari is here for Lynn Denham. Pat Agar is here for Basharat Ali. Matt Lamb is here for Richard Udo. And Louis Stephen is here for Tom Petrosky.
Thank you for that. Do we have any declarations of interest? If we don't, we'll continue. Obviously, if during the meeting members realise there is something that have a declaration of interest, they can declare it at that particular point. Next item is public participation, which we do tonight. We have Kate Wilcox, the head teacher of Pitt Marston School, and we also have the head as well, Mr. Neil Morris from the Christopher Whitehead Language College. So if they would like to come to the public speaker microphone.
Chair, just to say, we'll be inviting colleagues for the food poverty item, and not the moment.
It's for the food poverty. Okay then. Okay. Thanks very much for making that clear to me. In that case, then we'll move on to the minutes for the last meeting. Check the accuracies, which are on the yellow pages in your agenda papers. If there aren't any issues, can I have a proposal and a seconder, please? Thank you. Thank you very much. So proposed by Robin Norfolk, seconded by Louis Stephen. Thank you very much. So we'll go on to item 5, which is the first major item on the agenda, which is Worcester County Council Public Health Update for Worcester City, which is going to be presented by Matt Fung. I know I heard your meeting at your presentation at the joint collaborate meeting on Friday. I know it's an excellent meeting agenda item, so you'll enjoy it. So carry on.
Thank you for the introduction. Hopefully you can hear me. I'm just going to wait for the presentation to come up on the screen. But hopefully you've all had this circulated to you, so some of you may have already seen some of these slides. And indeed, this has only just been presented a short time before Christmas, actually, at the Health and Wellbeing Board at Worcester County Council. So hopefully this will work. JSNA. This is a statutory duty of public health that we kind of set out to produce and update. And this particular summary is something that we produce each year, gathering together the current evidence and essentially the trends, patterns of disease, infection, non-infectious disease as well, like cardiovascular disease, that is going on in our population. And it's what is used to effectively steer priorities across the NHS, commissioning, etc. So as I say, this is the 2022 iteration of the JSNA. And this year we took a slightly different format. It was basically done in a slide deck to make it really accessible. And you can see some of the chapter headings there that we included. I'm not going to go into every section in great depth, but this is just to give you a flavour of what's in the report. What tends to happen is people use this for, as I say, for their own purposes. So you would take a chapter that's relevant to your work, use it for kind of updating commissioning intentions and that type of thing, and understanding local populations. What we did for this particular needs assessment was to look at as well some public engagement as part of the process. So it was to kind of not just use national data sets and quantitative data. We wanted to get the voice of people into this report as well. So you can see some of the themes around the impacts of COVID-19, actually this was, around changes in routines, rising cost of living, mental health challenges, access to services, and a potential loss of trust in health and public services as well. And some of those barriers that came into play, as we know through the pandemic, such as lots of mask wearing and that interrupting and getting in the way of perhaps some rapport being developed between patients and professionals. So that's all in there as well. So it could be of interest to you. I would urge you to look at the fuller report to delve down into that detail. However, Worcestershire is generally a healthy place. You know, I've been here 5 years now. Worcestershire is a generally healthy place to live, to work, to grow up in. But we do have pockets of deprivation where people don't have such good health, and where actually some of our averages that we look at on a national level can mask inequality between the richest and the poorest in Worcestershire and Worcester City. Social determinants of health may influence health-seeking behaviour. We know that. We know that around 10% live in the most deprived quintile compared nationally. We know that rising cost of living is adversely affecting the health and well-being of people in Worcestershire and Worcester City. And the number of people living in fuel poverty is actually increasing significantly. And depending on what happens with the fuel caps, over half of our population could theoretically be living in fuel poverty if that gets taken off. So that's something that is already pressurising and could become more pressured in time. And obviously a collective effort and response is needed where possible. Obviously it's a challenging one to address, and there are interventions that you know, are in place and services that have been put in place, but actually it is very challenging for people to pay for all of these rising costs of living, particularly in energy. But the key themes from across the report, and again, these are headlines, so I'm not going to go into detail on every one of these. We've just mentioned the widening inequalities, and under there, cost of living, which needs obviously targeted interventions. We need to focus on reduction in unwarranted variation. That means that we provide access to services that isn't going to inadvertently, for instance, disadvantage one population over another. So where possible, we take that into account. We need to continue with our community engagement and really focus and double down on prevention. And to the pink box there, we have obviously an ageing population. I'll talk about that in a bit more detail for Worcester City. We have increasing pressures on health services because of an ageing population, but because of a changing population as well. And around that, we need to continue to maximise prevention. We need to maximise screening and immunisations that we know are kind of a national offer that aren't taken up routinely by everybody in our kind of county and districts. We need to keep on promoting lifestyle improvements, smoke-free, best start in life, etc. And there's a focus on mental health and wellbeing, and indeed that's a focus of the joint health and wellbeing strategy that many of you will have seen. Okay, each year we try and, as part of the JSNA summary, we try and draw out what is going well in Worcestershire, what is an emerging focus area, and what is consistently performing poorly. So those are the three columns there. But the emerging focus area, as we mentioned a couple of times now, cost of living inequalities in mental health and well-being. So it's not like mental health challenges are uniformly distributed across the population. They're not. They're more prevalent in some communities and populations than others. And a lot of this is linked to deprivation and indeed basically linked to income. That can be linked back to a lot of different challenges that we look at. We have a changing demographic profile, lower use of preventive services by the most deprived and ethnic groups. So we need to keep a focus on that. Challenges within the health and care system, waiting lists, emergency department pressures. And again, I'm going to show you a challenging slide on that right at the end of the presentation. Oral health, need to keep a focus on that as well. There's a conversation around fluoridation. You have different camps of people in support of and against fluoridation. But actually, children's oral health isn't particularly good in Worcestershire. So it's an area of focus and obviously something that can be prevented. NEET, so not in education, training or employment. SEND, which is special educational needs and disabilities. And again, we're doing some more work on that to really understand why we have a lot more children with SEND than we expect. So we're going to be doing, as I say, a lot more deep dive on that. Affordability of homes, people living and working and attracting workers to Worcestershire. So a range of issues there. So these are at county level. So just moving on, I just want to flick through these slides now because these are just some of the stats and the style that is within each of these sections of the JSNA. So real detail on population. Essentially, you can see a rise and an aging population that aged 85 plus over the next 10 years or so is increasing significantly, which would change the profile that we need for everything. Housing, NHS, access to social care, mobility. There's so much in there, and that's what we need to start planning for over the next decade. 75 to 84 also increasing. Actually, many of the older age groups are increasing, and also, interestingly, the 18 to 24-year-old bracket there as well. So we need to be looking at this across the county and specifically within districts. Okay, and just to say, as we know, ethnicity is changing. I've got a more detailed slide on this for Worcester City, which stems from the 2021 census. I'm not sure how many of you have looked at that yet, but I've got a few slides just to show you. So then, just scooting through these fairly quickly, there are chapters on CYP, children and young people, health and social care, housing, crime and community safety, economy and employment, and the environment. So there's a lot of data in there. As I say, hopefully some of that will be of interest to you. But I just want to focus down and hone down on Worcester City specifically. And these are some of the indicators that I pulled out from a public health perspective for Worcester City. And you can see some of these are just the ones that are ranking red. So Worcester City is a great place to live and work. There are lots of green ones, but what I find really focus the attention is where significantly worse or doing worse than England and our statistical neighbours. So that's what these red indicators are flagging. So there's something on children, the number of children in absolute low-income families, something on pupil absence, there's something on emergency readmissions from hospital, screening for cancer, which is a lot lower than we would expect based on the rates in England. AAA screening, that's the abdominal aortic aneurysm screening. So this is a screening program specifically for men, and you can see that that is a red ranked indicator. So it may say something about our men's health in Worcester City, health-seeking behaviour of our men. 33% of those eligible over the age of 65 have been through their AAA screening. It's not a great kind of percentage to look at when this is literally a screening program that can save men's lives. And so it's a commission program. Men will receive a letter through the post. There may be more education, maybe more awareness raising around this that we need to do. Certainly an opportunity that we can take as a county and a district. There's something on estimated dementia diagnosis rate. That's really for the NHS, but just to be aware that we don't think at the moment that we're identifying as many people as we could and should that have dementia. And again, that's something that we should be picking up as a system to put in place the appropriate support services. Loneliness and homelessness are the last two red ranked indicators. So that presents you a picture, looks very red, obviously, and as I say, there are lots of green indicators as well. These are where we have our opportunities to really make a change using many services that are already commissioned or in place that we can leverage more for the health and well-being of people in Worcester City. So I just want to quickly flick onto some indicators around the census. As I say, I'm not sure whether you've really looked at this yet or not. Many of these indicators are what you would expect. We've already talked about this. This first one is around population. Essentially, the grey bar, if you can't quite see, is the 2011 census, so 10 years ago, effectively. The blue line, or the blue bars, are the most recent census. So you can see, essentially, at the top of the pyramid there, that is indicating that the higher age bands, and you can see that actually for Worcester City, there's an increase in 85, 75 to 84, 65 to 74, 50 to 64 years of age. So actually there is an aging population, and you can see that very clearly in the data. There's some decreases, obviously, based on proportion in some of those younger age categories. So just the next one here is something on ethnicity. So essentially, there's a slightly lower percentage of people categorized as white ethnicity, and slightly higher in Asian, Black, and mixed ethnic groups. And again, I think that's not a surprise. It's part of the demographic change around Worcester City. So an aging and more diverse population. There's something that I put in here around actually kind of what people are living in, where do they live, and how are they paying for that. So slight decrease actually in the number of people who outright own their own house with a mortgage, and an increase in social rented and private rented properties. So it's just an interesting change in ownership there. The next one is I guess this is a green indicator, in that people have self-ranked themselves as part of the census as a high proportion in very good health. So that's a good indicator, I think a good win. Though in good health, obviously there's that's stayed approximately the same. Fair health, slightly decreased. So I think really it's although it's self-reported, I think there are some kind of green shoots there of people's health and well-being, despite the pandemic. And then you have something on being disabled. People who have self-ranked themselves as being disabled and limited a lot has decreased slightly, though disabled and limited little has increased slightly as well. So a bit of a mixed bag on that particular indicator. This last slide, that, or the last but one slide really, that I wanted to show is actually didn't actually appear in the JSNA because it's more up-to-date data than the JSNA was presenting at the time, and it's just to show you, although it's very small, apologies for some of the text there, but I'll explain it. It's showing that there are some pressure points on what people are dying from across Worcestershire, and specifically Worcester City, and particularly for cardiovascular disease or circulatory diseases as this ranks. So Worcester City, if I've got a pointer here, pointer doesn't work, I don't think. Oh yeah, yes it does. It just doesn't show on the screen. Okay, Worcester City is the fourth set of 3 bars along, and the different colours indicate blue is the average of 2015 to 2019, so that's a 5-year average that we tend to track. That's pre-pandemic. 2020, which is the orange bar, you can see there, and the grey bar is 2021. And it's a bit difficult to see, but what it is showing is that the rates of cardiovascular disease are heading up slightly, not down or not staying the same as what they were pre-pandemic. And for me and public health and the health system, that is something that we need to really get to grips with and understand why that is happening. I can hypothesize with you, but it needs a greater deep dive into the reasons behind that. And some of this you can track back to things like uptake of NHS health checks, something that will identify cardiovascular risk factors and try and reduce those in people who are at risk. We know that those risk factors are not identified as prolifically, if you like, in more deprived populations. So actually, this is not splitting this by deprivation necessarily, but I know that if the team did split this by deprivation, and if I was to show it now, this would have a big gradient on it, which would show the most deprived people dying in higher numbers or at higher rates than the least deprived people for cardiovascular disease. That's what that would show. On the right-hand side is neoplasm, so cancer. Although there are some pressure points across the patch, actually Worcester City has come down to around about pre-pandemic levels for deaths from cancers. So although it's something that we absolutely should continue to focus on, and as you saw earlier, there are huge opportunities for our cancer screening programs to increase uptake, which will press down the trends here, even in Worcester City, even further than what they are now. As I say, just to reiterate, what I am concerned about though is cardiovascular deaths and how many of those are going to be preventable across the population. And there are things that we can do. So it's not just a pie in the sky, wouldn't it be lovely if we could reduce this? We can. So what can be done? I've presented here before a couple of times, and I think what we need to get to as a system and for Worcester City is, so what does all of this mean? And this slide is starting to do some of that. Maximise prevention. We talk about prevention all the time in public health, boosting screening, immunisations, NHS health checks, cardiovascular disease checks. It all exists in our existing healthcare service. And actually, there's, as you've seen from that previous slide, quite a lot of deaths can be prevented through the right diagnoses and interventions. They're not even complex interventions. Many of these would be, you've got a high blood pressure. What you need to do is modify your diet, stop smoking, do some exercise, lose a bit of weight. Those are generally the thing. They're really low-level interventions, but it will cut out a lot of unnecessary kind of higher levels of deaths that we see. And as I say, it's not just a shame that people aren't using these interventions. It literally is a case of life and death. But for some reason, sometimes our messaging doesn't get through to the public, or there's an apathy in accessing healthcare, or people don't understand, or the education isn't there. So there's lots of different things that we need to carry on working at as a system. We can't do this by ourselves. It has to be a system effort, including, I would argue, district council colleagues as well. Targeting interventions and services. And I'm happy to come back to talk to you about that at a future meeting, including the Prevention Response Service, which is going to be a fabulous new service that's just been worked up, which will do exactly that, target interventions at populations that can most benefit from those. District collaborative, we talked about that, Stephen mentioned right at the beginning. I'm not sure how much you know about that, but it is a fabulous network collaborative of different organisations across Worcester City, including District Council. So Lloyd chairs that particular group. It has representation from the NHS, Public Health, VCS, housing. Everybody gets together and tries to figure out what to do about specific problems. And as I say, it's a great forum to do some practical work. And it's actually a legacy of our work during COVID on COVID vaccination. Communities and engagement, maximising that opportunity there, community development, using assets in the community, addressing social isolation, which, as many of you know, is a real risk factor for really bad health. So actually, it's an opportunity there. Maximising jobs and work, maximising income, because actually health and well-being isn't entirely linked to, but it's very much associated with a rising level of household income. And then facilitating healthy living through health and spatial planning, right in the remit of District Council. Active and safe travel. improved food environment, warm and safe homes, and improving cost of living support. So there are some really practical things that can be done. Yes, they're high level, but I think it's getting underneath some of these and thinking, what can be done? How can we promote, for instance, screening and immunisations in ways that we haven't, even amongst workforces in the district council, amongst our partners, etc. So there are lots of opportunities. So on that, I'm going to end. There are a few different links there that can be accessed, and that's where you would go for the full report from the JSNA, Worcestershire Insights, which is a dynamic data platform that you can access real-time information onto the Census 2021. Thank you, Chair. So really happy for any questions.
Thank you very much, Matt, for that really good, thought-provoking presentation. And certainly, one of your later slides about the recommendation thing to do, these are very much some of the initiatives that this council and this committee will be discussing over the next hour and a half or so. So the first hand I saw was Louis, so I'll ask him for the first question.
Thank you for the presentation. There's lots of information there about gathering data and knowing where we are, and we can see things are going well and things are going perhaps less well. And I can see things like promoting active travel, for example, as a way of reducing obesity and improving people's fitness and so on. I've got a question though about things like screening for cancers and so on. What can the county council do, and how does it work? How do you sort of commission more cancer screening? Because I would have thought that was the NHS who does that. There are certain things that county council is responsible for, but it's probably not provision of cancer screening. So what influence do you have on things like cancer screening?
We have lots of influence, to be honest. We chair a health protection board in county council, so we hold to account. You're quite right. The NHS technically commission screening programs, but we hold the NHS to account through the health protection board, which will include screening programs and infectious disease programs, etc. So we have a lot of influence there. And in fact, screening and immunisations is being devolved down to local level over the next year, so we'll have even more control over how that's delivered locally. The important thing though is to be right in the centre of that conversation, to steer the commissioning of services using local intelligence, local data, and local insights. So it's not just the data from my team. I think it's what we see across local areas as well. So if you're aware, there's something going on, some barrier to access, then let's have a conversation.
Okay, thank you.
Thank you very much for that. Next one, I've got James Stanley. Anybody else speaking? Okay, I've got Jabba Riaz next. So James first, and then.
Yeah, thanks very much. Really good report, hugely interesting, lots in there to digest. I guess the one question that sort of leaps out for me is the level of data that we can get about communities that are traditionally hard to reach. These are communities that, by extension, find it difficult to get particularly well-paid employment. They are, those things that you drew out in the report are clearly issues that matter to areas of the city that are struggling to get, out of that deprivation cycle. Yeah, there will be questions of engagement level with them. So all that said, and you made reference to it in the presentation, how do we then, find a way through and to navigate through there? Because there are clearly issues that need addressing there. And I think that one of the things I would sort of highlight is the fact that, that there are areas of deprivation within certain parts of the city, the area that I represent. But I'd like to see, the real drilling down in that, because in certain streets, in certain parts of the city, there are pockets of deprivation, that exist alongside relatively, areas that are quite comfortable in a relative sense. So, but if you could, a little bit more detail on those hard to reach communities, because I think it's quite significant.
Absolutely. It's a great question. This presentation obviously is fairly high level. What we plan to do for the next iteration actually is to drill down into some of those kind of more local communities that we can actually see where people are dying a lot of years before they should, or accessing emergency care more than they should, because actually emergency care is a proxy for uncontrolled illness, disease, whatever you want. You're right, hard to reach communities are hard to reach for a reason, because we don't collect data, perhaps in a way that really highlights an issue in that area. They're not necessarily registered with GP practices. That's a really big one actually, because to even receive a letter for cancer screening, the NHS needs to know that you exist. So without registration, these people aren't going to be picked up through cancer screening programs. So letters will go out nationally or through a local hub. If they're not on the system, they don't get a letter, they don't get an invite, they don't get the screen. So one of our challenges actually in the first instance is to improve our data through targeting communities to register with a GP practice. That's the starting point. And we have to be really intentional about that. And as I mentioned earlier, the Prevention Response Service will start to do some of that. So that's very targeted. We know we've got a lower uptake or a lower registration rate in this particular area. Let's send a van in, like a health van, and let's get people registered. So for me, that's the starting point. And from then, we need to then start to get a bit of a wraparound care set of interventions and that. So I think it's almost going back to basics again, actually. Not running before we can walk, and really understanding where our gaps are in terms, or our cold spots in terms of registration. That has to be where we start.
Thank you for that. I've got Councillor Jabarias next. And then following that, did you, Robin, you stick your hand up? No? Okay. And then after Jabba, Lucy Hodgson. So Jabba next. And then Pat Hagar.
Yeah, thank you, Chair. Can I say thank you for that excellent report and full of really, really useful data. I mean, no doubt. I mean, I think everyone's just as shocked as we are that yet again the poorest in our communities in our county suffer the most because over COVID, suffer the most because of lack of resources, suffer the most because of the cost of living, suffer in every way educationally, and it's an absolute shambles that this is the case. I mean, we recognise that, and that we are putting in measures, and it highlights the importance of this committee, the importance of why this committee was set up, and the data that it's provided, and the level and depth of conversations that we are now having in addressing that. So bravo to the council and to the committee for being able to tackle the hard issues. I've got a couple of questions on there. I mean, we've got to look at the wider picture. Some of the red lights, red marks that you've put in terms of the dangers, how many of them can be related to the chronic underfunding of the NHS? How many can they be related to the lack of resources from our GPs that weren't able to address some of those conditions? That would be a really interesting question for you to answer. Secondly to that is that a lot of emphasis now is being placed on the voluntary sector to pick up where the NHS isn't picking up, or I've been involved with the voluntary care sector alliance, which is being newly formed currently regarding that, and it seems over COVID, a lot of the voluntary sectors have come to the forefront in dealing with these very issues on the forefront in terms of loneliness, in terms of health and conditions, and of course they're going to play a key factor. But it seems as if a lot of that responsibility, that important responsibility, is going to be brushed off onto those voluntary community organisations to pick up the role of statutory organisations and the government for failing to look after our poor.
Thank you for the questions, Councillor Rees. I think you've highlighted some important issues. Lack of resources. We know that primary care and secondary care are both incredibly challenged, aren't they? I don't think there's a day that goes by when we don't see some report in the press about this delay or this waiting time that's extended. In terms of, I mean, there were quite a lot of intervention, red indicators that I flagged. I think it's fair to say that all of them, pretty much all of them, have an action plan or work behind them to try and improve where they are. It's never been the case, though, that any of those indicators was 100%. There's always been populations that haven't been reached, and always populations that have actively declined taking up a particular offer. So we'll never get to 100%. But what I want to see is an effort being made in terms of education. I think education of the public around the importance of a screening program or a vaccination program and dispelling myth is the most important thing that we can do. I think there's enough resource in the system to screen everybody that wants to come along to screening. So I don't think that's an issue. For instance, if you talk about cancer screening, I think it's more about getting people into the system in the first place, and particularly those that are more averse to kind of attending. Perhaps they have a fear of general practice. They have to, think about their own mortality or morbidity as well. There's a lot of education and breaking into communities. So one cancer program that I would really advocate actually is the bowel cancer screening program. It has recently changed last couple of years from quite a cumbersome process where you had to take 3 different stool samples and leave it on the side, and it wasn't very nice. So I get why people didn't return the samples. Now it's just a single sample that you do and send in the post. I think there's a lot of barriers actually that have been broken down through things like that, and we've got to get the messages out to people who receive their kit and a letter to actually kind of take the test and return it. It's a really simple thing to do. So I think we need to leverage that type of opportunity. VCS are fabulous, and we can't do what we want to do without them. But we need to protect them as well and what they're doing.
Thank you very much, and certainly the comment about the bowel cancer, very interesting, because I was sent the pack just after Christmas, and it was very simple to do. And what really impressed me was I actually got the results back in less than 10 days, which thankfully were negative. So it shows that the system is actually working well. And hopefully the response rate, which is a question I asked about the previous meeting we went last Friday, was obviously about the response rate to these things, because there's 2 elements. One is people who are hard to touch, so they're not on the radar, so we don't know about them. And secondly, when people get offered these tests, they need to follow them up as well.
Absolutely. And quite often, whether we look at COVID vaccination, which we've learned a lot from actually, through going out into, specific communities, and offering vaccination right there and then, to that community. What we tend to find is, I think as Councillor Rio said, the most deprived and ethnic communities, quite often it's the same communities as well, most deprived and ethnic, are the communities that don't necessarily take up the offer as much as others. So we need to really double down on, are the messages that we're sending out getting through to those communities? Are they understanding what needs to be done with a particular test, what it's going to do for them, how it's going to protect them, and the simplicity of it? Quite often it's kind of circles of friends that, they'll all decide, oh, I'm not going to do this, and therefore that permeates. And we've seen that quite a lot actually, particularly through COVID vaccination. If you get one vocal person, actually they influence a lot of people. So what we need to do is get those vocal people to say, I'm doing this because it's the most sensible thing that I could possibly do for my health and well-being.
Aaron Lauren. Then after that, I would like to bring this item to a close, because obviously we've got quite a hefty agenda tonight. So please, so Lucy,
thank you for that. I'm going to sort of carry on about and people's reluctance to actually come forward for screening and that sort of thing. So the abdominal aortic aneurysm for screening is a perfect example. And what do you think you can do to actually make that more accessible, and really it's the it's the housewife or whatever, or the housewife in Walden villages and that sort of thing, as well as being the other parts of the city who think, well, it's never going to be me, so therefore I don't have to go to anything. Do you understand what I mean?
You mean it's always going to be somebody else?
Yeah.
I guess part of this is, I think, we talked about this at scrutiny actually in County Council last week, and there is something about men's health and what we're trying to do through starting with NHS health checks, which hopefully some of you would have been to, received an invite for, maybe you haven't. Hopefully you will do in time. We've incentivized GPs not just to do health checks for anybody, but to really target men in the most deprived areas, because we recognise through all of this data that that's our risk group. And part of this is increasing awareness of men of their own health and actually doing something about it, not saying, oh, I'll do it next week, or I'm not going to be the one that gets that cancer. Because actually what happens is men will go and get seen when it's too late. They'll get all the symptoms that you don't want to be getting, or whatever the cancers that you're talking about or issue, and it's too late. And it could have been picked up years ago with the screening tests that we have. So we have to use opportunities like the NHS Health Check, because that's a national programme. It's already, we pay for it from public health. In Worcestershire, we paid GPs to do that. And we only started this new system back in about September last year. So we have to wait a little bit to see how effective that is. And also coming out of a pandemic as well, I think a lot of things need to settle down, normalise, and then we'll see where we're at. But you're quite right. I think it is awareness raising and getting men to think differently about their own health and well-being.
Thank you. Thank you, Chair, and thank you for this report. It's been really interesting. I mean, quite a few of us around the table either are or have been county councillors, so some of this is familiar. And some of the things I'd really like to highlight. I mean, some of my colleagues here have talked about, in so many words, about trigger levels and morbidity. And I think those trigger levels are a big concern, because when you do drill down, you find that those communities have multiple needs and quite complex needs often. So, we need to be able to identify those pockets within our areas. I think we all know where they are, but sometimes the trigger levels don't identify them at strategic level, and we need to be sure they're going to, because that's a real barrier. The other thing is there's a wealth of research on child poverty that says that if you don't get good nutrition at an early age, you stand a much higher risk of stroke and heart disease in later life. So you're going to be a huge burden on the health service and to yourself as well. So I think it's essential that we actually crack down on getting this child nutrition and child poverty right. So whatever we can do in that respect is going to yield benefits further down the road. The other thing is cancer screening. Now, I can see that cancer screening needs to improve a bit. When I've talked to practitioners, consultants and so forth previously, they've said, oh, we need more equipment. Well, actually, I'm not sure that's entirely the answer. Yes, they need more equipment, they need more screening, and they need more staff who know how to do the screening, but particularly the diagnosis side of the screening, because sometimes they don't mesh. They're not always available when they need to be. That was true for stroke as well, in fact, for a long time. I think we've now got a better pathway through our acute trusts for stroke, so that's better, but I'm not sure that's true necessarily for the cancer pathway. And there is something about the stats that mask the fact that you can be screened and diagnosed, but there's a long wait for treatment. There's a big gap between diagnosis and treatment, and often monitoring happens, but no treatment happens. And at the moment, that's a big problem, because we we've had the COVID crisis. We know that we're behind with some of these treatments, and it would be comforting to think we were working terribly hard on catching up.
Thank you for the comments. I think there's a lot in there. I'm going to take the child poverty, child nutrition one actually, because it's an interesting point. Absolutely, children should have the best start in life. The evidence is really strong for that. Right nutrition is absolutely key, though, isn't it? What we're seeing is Year 6 children across Worcestershire being overweight and obese in much larger numbers than there were pre-COVID. So that's a bit of an issue as well. So the right type of nutrition, the right type of parenting, the right opportunities, because you say everything sets the course for a child's life. So we need to get it right from the outset to give children the best opportunity that they can. Cancer screening equipment, that's a difficult one. I'll leave that to the acute to tell us about. There may be issues, but certainly not on the initial screening phase. They may be talking about things like flexi sigmoidoscopy, which you have if you have a positive kit that you've sent back. But that's another conversation at the talk.
I think we're all starting this.
There will be as well. Yeah.
Thank you. And the final question from Karen Laura.
Thank you, Chair. My question is about you mentioned oral health and that children were having poorer oral health. There's been a shortage in NHS dentists, which I believe is. But have we got a programme where we are bringing in the pop-ups that you mentioned to increase screening of children and working with the teachers and also some of the adults, if they've not got good oral health and they're not following a good oral health regime, then their children won't. So is there a trend towards people not paying enough attention to their teeth, and that leads as an indicator to their general health in question, isn't it?
It's really complex. You know, you can talk about oral health and people think, you know, brushing your teeth, seeing your dentist. Actually, if you're a deprived child and you have to have multiple extractions and you've got lots of, you know, diseased and missing teeth, actually that's time off school.
Yes.
And it's time out of education. So it kind of compounds the issue of being deprived in the first place. One of the issues of kind of oral health. We have an oral health steering group in Worcestershire. So we try and capture as many things as we can through that particular programme, including things like supervised toothbrushing for children in the most deprived settings that we can identify. So there are proactive things that we're doing and working with schools and that. So it's not like it's a thing that we flag and not doing anything about. There are things going on, but there are a lot of children that are still at risk. And our children's teeth are still not as healthy as they could be. Fluoridation only covers part of the county as well. We know that fluoridation massively improves and protects the health of our children's teeth. There was a point actually a few years ago when I think Worcestershire was as bad as Sandwell for children's teeth. Actually, Sandwell was slightly better than Worcestershire. So when you think about deprivation, that should not have been the case. So the difference being Sandwell is fully fluoridated, Worcestershire is not. So it's one of the protective factors that we promote, as well as things like supervised toothbrushing and generalised awareness. You're right, it has to be a family-based approach. So if mum and dad or guardians don't have, you know, great oral hygiene and health, then it's likely their children won't either.
Thank you. I'm also sort of like concerned that toothpaste is generally quite a good quality toothpaste is expensive. Toothbrushes are expensive. If people are struggling for food and other things and heating, they're going to be buying cheaper toothpaste and maybe not brush and maybe dropping it off the schedule. So is that available? Do we know? Is that available through the food banks? But really, could people have it on prescription? Or?
In extreme circumstances, medicinal quality toothpastes which are not available to buy can be prescribed to a dentist, but only in the most severe of cases. Otherwise, there are no toothbrushes that are systematically supplied to children, except for things like our supervised toothbrushing programme. it is a gap. It requires funding if we were to kind of, promote that way of working.
Thank you very much, Matt. That was really interesting presentation. A lot of, yeah, if you like, food for thought going forward. It's certainly been very useful. And thank you very much for coming. And I will, no doubt you want to leave now because you've done your piece for the meeting. And I will now ask Lloyd to give us the update on the delivery of the Child Poverty Task and Finish Group recommendation.
Thank you, Chair. And Kate and Neil may want to swap with Matt for this item as well, but I'll start off and give them time to come in. Chair, this is the third update report on this subject. Previous reports have been presented in November 21 and June 22. And absolutely acknowledging this is an important subject for this council, just to manage expectations of members. Obviously, the statutory responsibility around safeguarding children sits with the county council and not the district council. So this is a discretionary piece of work for us that needs to be delivered along other pieces of work, and it's carried out across a number of services, not just owned by one service. So just to run through the recommendations, the first one was to work in partnership with the Health and Wellbeing Board. I think we have senior seats around the Health and Wellbeing Board. Councillor Denham and yourself, Chair, you sit on that and represent the council. And you're also members of the Integrated Care Partnership Assembly that covers Herefordshire and Worcestershire. The Health and Wellbeing Strategy has children and particularly around inequalities all the way running through it. And as Matt has mentioned, we also have the District Collaborative, which Worcester City chairs. And again, one of the priorities of the collaborative is providing the best start in life. So I think, Chair, in respect to that recommendation and working in partnership with Health and Wellbeing Board, officers believe that that recommendation has been completed. The next one is around considering child poverty within established health inequalities groups. Again, referring back to the District Collaborative, there's a clear priority in there around starting well in life. And that work is overseen by the Health and Wellbeing Board and the Integrated Care System. Healthy Worcester is also a group that sits locally and has child poverty at the centre of its thoughts. And obviously we have this committee that also will feature child poverty as a priority. So again, Chair, officers believe that recommendation can be completed. The next one is around completing a food poverty JSNA. Well, that's on the committee tonight. That's been provided. So we believe that that recommendation has been completed also. Recommendation D was a local multi-agency Worcester City Child Food Poverty Group to be set up. We don't believe that is necessary. I've mentioned the groups already this evening that are sitting, that are looking at child poverty, that have those priorities as part of their work. And we just risk duplicating other people's work and time and effort if we had to set up another group. So we don't consider that necessary, and we believe that recommendation has been completed. Recommendation E is to support the food bank in finding a new location. That ask of the food bank has now gone away. Our officers meet regularly with representatives of the food bank. And just to remind members as well, we also fund the food bank every year. And in 22-23, we funded them to the tune of over £100,000 through a mix of household support funding and hardship funding. So again, we consider that recommendation considered to have been completed. Recommendation F was around suitable council land or allotment space to be used to assist with food poverty. That's definitely one that requires further work. So whether that's looking at underutilisation of existing plots, or whether there's better use of sort of spare land within our allotments, or as well, looking at whether or not there are any existing arrangements between plot holders and community organisations that are contributing to this area. That piece of work needs to be done, and we'll do that through our allotments office. That remains in progress. Recommendation G was to review the relationship of the Worcester DWAS scheme along with this piece of work. I'm not going to steal Rosie's thunder. Rosie has a report on this item a little bit later. That work has now been commenced, but still a bit to do there, so that remains in progress. And the last recommendation, Chair, was around making best use of the £50,000 that's specific to this item. Members will be aware we've not spent any of that money yet, and neither are there any allocations made against it at the moment. But just to reassure members that there is no plan to withdraw that money for next year. That remains available to this committee. What I would say is there's not been a clear direction to spend it from an officer point of view. We've not seen anything to obvious to spend it on. And there's also been quite a bit of money in the system. So whether that be household support funding, previous to that COVID funding, you know, we've been able to cover everything we've wanted to do through existing funding. Now I think with the agenda that members will have had tonight, I think that will give us a better idea of where we want to spend that money next year. I think the plan of officers is to go away from this evening and draw up an action plan and bring that back to a committee at a future stage for your endorsement. So I'll stop there, Chair. I do wonder, I know we've got an item on food poverty coming next, but I do wonder whether Kate or Neil want to pick up anything non-food poverty related in respect to this item, first of all.
Well, I would agree, yeah. So any...
I can spend you 50,000.
Yeah.
I've got many suggestions for your 50,000 to be spent, which we can tip into in here.
Yeah, I think most of, in terms of the education perspective, it links, doesn't it, with the food poverty and your committee in terms of health and well-being. But there's talking to colleagues, head teachers from the city, we've tried to gather what those challenges look like within the community and how, you know, head teachers and school settings are trying to cope with these high levels of need. So a lot will link. It's whether you want us to share those bits now or carry on with. It's up to you.
I think the purpose of this evening was to hear from you, you know, on the ground as to what child poverty, you know, stroke food poverty looks like, what you're seeing, what you're feeling. But absolutely, if you've got any ideas that you think, you know, we and the wider system should be focusing on, I think members will be all ears.
Shall I start?
Yeah, you can start.
I'm the head teacher at Christopher Whitehead Language College, so that's the largest school in Worcestershire, in St John's, approximately 1,500 students. I've got 20% free school meals. Now, to get a free school meal, you have to have an income, household income, of less than 16,000. Now, that's gone up from 14% in my school from 2019. I've got huge problems with attendance post-COVID. Pre-COVID, we were 96% as a whole school. Attendance was fabulous. It's 89% as we speak as today. I've got 25 kids who've never come back after COVID. We've only got 7 education welfare officers in the whole of Worcestershire. So that's 150 plus schools, and there's only 7 educational welfare officers going round door knocking. So we as a school, the infrastructure is completely broken. We've taken the decision, we spend 256,000 on what I would say 10 years ago we wouldn't have spent on. So we have 3 counsellors. That's for staff and for students. We have 3 attendance officers. We have our own EWO, Education Welfare Officer. We do it ourselves. We are spending a huge amount, and we're in debt on food. We've got children stealing food from Sainsbury's. Not stealing, I wish they were stealing in a way, water pistols, but they're stealing sandwiches. The system is broken. The Victoria Climbier report, the poor little girl who died in horrific circumstances in 2015, recommended social workers had 1 to 15 cases. I don't know of any social worker in Worcester who hasn't got over 35 cases. It's absolutely broken. We are measuring, we feel like King Canute, and we've got the finger in the dam. We spend 215,000 on 15 staff that 10 years ago I didn't spend on. So 50, I'm not being glib, I would take your 50,000. I could have an education welfare officer, I could have a counsellor. We've got children who are trying to commit suicide, and we're dealing with it on an everyday basis. And I'm dealing with the sort of fallout of COVID, and my current year 8 and 9 who missed year 5 and 6 due to COVID are way behind in everything. I've taught PE. We used to do a 5-minute run at the beginning of lessons. We can't even do a 5-minute walk. Kids are that fat. We used to do a 40-second plank. Kids can't even do 20 seconds. And you could go on and on.
Yeah, I mean, I've tried to gather some information from different colleagues, but Jane Price, who's the head teacher at Bishop Perrone, echoing very much what Neil Morris is saying, and just saying free school meals are higher for her than they ever have been, and it's increasing year on year, and the challenges vary in size. So she was talking about spending £4,000 on uniforms since September, which at this point in the year, that's 3 times more than she's ever had to support, just to support children having shoes, having the ties, and meeting those school uniform requirements, to the point that children can't afford their winter coats. They want to wear hoodies. Parents find them cheaper. So actually we've got children, and I can echo this, in a primary school that don't have coats, and we're trying to obviously then provide, and parents are very proud. They don't want to ask for lots of these things. Jane was talking about being overwhelmed by the cries for help. She had 74 calls in 2 days from parents after they put together a video with the Salvation Army offering support for Christmas Day for presents and food, and within 2 days 74 calls had come in, not wanting to be known, not wanting to be seen collecting packages, but just extreme levels. She's really concerned about the level of debt she's building up on food, saying that it's a real moral dilemma because the parents can't pay for food. So does she feed those children in school? Well, of course you do, but actually that's a £7,200 debt that is in one term. So again, it's money that's not being spent on education, but actually is for the welfare of the children. And free school meals, like you're saying, that allowance, it isn't enough to feed these children, particularly the older children, when they want breakfast, snack, lunch as well. It's not enough to actually cater for those needs. Echoing primary sector, talking about huge levels of support for trips and visits. We all want these children to have the same opportunities. £8,000 being spent already to support those children going, and just all professional colleagues saying the mental health demand, the pastoral safeguarding demands, people are doubling teams and dealing with such high levels of domestic abuse referrals and support in school. So yeah, that was very much a secondary perspective. Primary, seeing things which really sad, but seeing things like parents withdrawing any kind of music lessons and things, those non-necessity things, I suppose, that children don't really understand, but they're desperate to do. But of course, parents choosing that just can't happen. And obviously the food issue. Support through family support workers. We're seeing at Pitmarston the amount of parents now needing support to manage debt finance management and coming to the school business manager and asking for help to control their debts, and actually what can they do to improve those situations. And just referrals from school for the food bank, we're just seeing a 200% increase. My business manager worked out for me today. So as a whole, in terms of schools, it's just a huge picture of how need has just increased dramatically. And actually those hard-pressed families are really struggling the most as well. Those families that aren't entitled to much financial support, we're seeing those families coming forward and asking for more and more help. And I think staff need to be mentioned as well, really, because as a school, you're managing staff. Staff are struggling with this, and just the huge amount of absence from work linked to mental health, but also teaching assistants leaving because they can earn more money, actually stacking shelves in the supermarket as a non-term time job. And we're losing amazing professionals from our schools. That's come from a number of head teachers. And they don't want to leave, they want to work in schools, but actually they've got their own cost of living crisis and they want to be able to bring more money into their own homes. So we're trying to do lots of things, weekly money saving tips for our employees linked to the local authority benefits and things, but yeah, it's a huge picture for us all to be dealing with at the moment. It's quite overwhelming.
Thank you very much for that. I'm sure some members will want to ask some questions on this. Yes, Councillor
Not so much
Hagar?
a question, it's more than empathy, I think, because we recognise that you are very much on the front line. And we're going to have to think carefully about what we can do to help and who we can influence to help as well. I hope very much that we will do that.
I suppose I'd make a comment. We used to be able to adapt. So there's a 24-month waiting list for children and mental health service. There is, if I permanently exclude, and I hate doing it, a child, they're likely not to be in school again for at least 11 months. The waiting list there is nowhere you can put these people. We used to have motor vehicle for hard to place disengaged boys without being too stereotypical. That's gone. Everything has been cut. There is nothing left to cut. So unless we do it, there is nothing else we can do. So we're constantly looking for money. We raise our money, we try and raise 40, 50,000 a year, Christopher Whitehead, to try and keep things going. And we have a second-hand shop, which is thriving. We try and run a ball for our year 11 leavers, like many schools. We allocate 60 free tickets to get them through that. They have second-hand suits. Our worst attendance is on non-uniform days because the kids haven't got any trendy non-uniform, so they don't come to school. So we do only 3 non-uniform days in a year because we don't want to label or identify people by making them feel that they're not trendy because they haven't got the latest trainers or whatever. It's incredibly sad at the moment and it's incredibly tough.
I think the increase as well in terms of trying to manage that level of mental health in schools, not every school can afford to double their play therapist hours or increase their counsellors or Thrive teams. So again, I think some of the smaller, would you agree, the smaller primary schools are really struggling with that in terms of trying to pull that level of support together.
Chair, just to add, we've got an educational rep on the district collaborative, which is a representative from Howe College, and between them and the primary care network, they did identify there was a growing waiting list around mental health support, both for younger age children and for sort of 16 to 18 year olds. So I'm glad Kate and Neil have mentioned that, because obviously that marries up. What I am concerned about, that was 2 posts. And I think that's probably not even scraping the top of the mountain. So I think there is a further conversation to have with colleagues around, actually to try and make a dent. What does that look like? Because the council has invested money in those 2 posts, and I'm sure there'll be a bonus. But I think there's also something about managing expectations around the limitations around it as well, given the amount of funding that we've got available to us, which isn't a great deal.
Yes. Any further comments from members? Yeah, Councillor Lucy Hodgson.
Well, what would you like us to bearing in mind, we're not the county council, we're the district. But what would you like, maybe 1 or 2 or 3 things that we could help with? Or if not us, other people, maybe the voluntary sector or that sort of thing?
It's where to start, really. I mean, attendance is my biggest issue, and they're not attending because they're often looking after younger brothers and sisters, and people aren't coping, the parents aren't coping.
Parent mental health plays a huge part in that, doesn't it?
I suppose it was very interesting listening to the presentation before, because I worked at a school called, it was Franklin, and it was in Worcester, and everything was at that school because they trust the schools. So at the bottom of that school, there was the social worker, there was the dentist, there was the doctor, and everyone came into that school because they trusted the school. I served 35 primary schools, and many of my more disengaged primaries are not going to the doctor, they're not going to the dentist, they don't trust, they do tend to trust the school. They've got into the habit of going to the school, but they don't go elsewhere. And I've been saying for 20 odd years, why haven't we got a social worker at school? Why are they always in the car, coming late to meetings? We've offered places, we've offered offices for them, hasn't been taken up.
Yeah, I think the EWO support would be very welcome from primary schools. I think some secondaries have those, don't they? Primaries, we don't. So I think that would be huge in terms of bringing children back into school and having that higher level of support. Because at the moment it is head teachers banging on doors and going out and picking them up in their car and school minibus if you've got one. So I think that would be huge, and I think anything that can be done to support bringing down those waiting lists for children who are suffering so much at high levels of need for CAMS support. I think for us in schools, that's one of the biggest frustrations. You know, I'm lucky we have our own educational psychologists and speech and language therapists, but schools don't. But CAMS is a whole different level. We just can't access. We really can't access, can we?
No, you have to, the streams that you have to get emergency access to CAMS is astronomical, really.
The level. Yeah. Okay.
If I was to throw a grenade in, the secondary head teachers wonder why we need a £40 million new school. We wonder if there's the need and wonder if it could have been alternative. And it could have been an alternative school that would have picked up some of the needs. We're not sure there's the need, we're not sure there's the places, and it seems a lot of money to go, and where it's being situated will put, there's always been a sink school in Worcester. I was that sink school for a while. Bishop Roan is struggling at the moment, he used to be Elgar, and the placing of this school near to Bishop Roan, I think is quite controversial.
Okay, Councillor Jabarias.
Yeah, thank you, Chair. I mean, obviously, real harrowing picture being painted by Neil and Kate, isn't it? Kate, yeah. Neil and Kate in terms of the situation in schools, and quite shocking to be fair, and similar across the country. I mean, across the city in terms of the information that you've got, it seems that a lot of the problems. I don't know how they sit with our committee in here in this specific sphere. As Councillor Hodgson mentioned, a lot of the issues, I suppose, stem from up the road in county, and whether we could take on board the recommendations that Neil and Kate have said and feed them into our colleagues up at county to address some of those concerns. I mean, obviously, the budget that we've got is minuscule in terms of dealing with anything that you're recommending here. A lot of them are. It is an ongoing revenue cost and a more systematic approach that needs to be dealt with. And we've got limited means, but we are here to obviously listen and to take on and to lobby the cause up at county. And it's really appreciated that you've come and told us the cold hard truth, because actually parents sometimes, as you said, are proud, and they don't want to talk, and it manifests itself in kids stealing food from Sainsbury's and wearing hoodies and going about it, that you have to find kind of eke that information out of them. So humbled, I suppose, humbled and ashamed that we're living in a society that it has come to this, right? And that our children are suffering, and our teachers that were once bastions of education have been reduced to, caring for children instead of educating.
Pat Hagar and then James Stanley.
Thank you, Chair. I'll be as brief as I can. I think we're going to need to think this through in detail before we make any real recommendations. But one thing you did say that struck me is you have a school spending on food is 7,200. Now that's something we could do something about. It's within our means quite easily. Perhaps we could help with that.
Okay, we'll
It's a
note
thought.
that. Councillor James Stanley?
I think it's about as well, isn't it, trying to keep the price of the school meals as low as we possibly can. So some of my colleagues in primary schools were saying they're fighting to keep that amount to £2.20 a meal. But actually when the cost of staffing is going up, the cost of food is going up, the cost of electricity is going up, it's really edging towards £2.50 a meal. And one of my colleagues had worked that out, that increase for a family of two, that makes their lunches at £970 a year, £75 a year. That will go up by £118. So it's things like that. How can we try and keep those prices down when actually all of our prices are going up? It's that level, really, which links, doesn't it, to food and poverty. And
Chair, thank you. Again, brevity, but I would underline Pat's point particularly about the need to really interrogate what we have before us here, so that those areas that we can positively touch, we do. Clearly, there'll be much more work that colleagues up the road can look at, but there are things that we can get a grip on here, and I hope that we do that. In my own county division, my wife used to work in the local school, and her each day there were stories of parents who simply hadn't they needed a lot of help. They needed a lot of guidance in areas where, certainly when I was at school, that you know, living in similarly challenging economic times on occasions, but there was still a real, you know, in areas like that, there was a real sense of community. It still is to some extent, to a large extent, but it, you know, we are, and one of the positives of COVID has been putting some energy behind that community feeling again. But I do think we have got to, as colleagues, all around this table, take this document and really look at where we can, you know, make an impact. See it in the issue in its entirety, and it can slightly overwhelm. But I think we've got to look at it and really drill into those areas where we can help. So, yeah, thank you.
Thank you for that comment. You got any further comments you'd like to make? Yeah, I would like to certainly thank you very much for coming to tonight's meeting. You've certainly given us a lot of food for thought, and I think you've also shocked some of us as well with you know, your stories from the coalface. I mean, my mother, when she was alive, she was a special needs teacher, and she taught at a special needs school in Hartlepool, where some of the sort of types of poverty and symptoms happened there, and that was back in the 1970s. It's very disappointing that in the 2020s we're still having the same issues to actually contend with. So yeah, thank you very much for your contribution. We've got two agenda items, item 6 and item 7. They both have similarities in that they're both really relating to the same theme, which is food poverty. So just to wrap up agenda item 6, can the committee please note this? Now we can move on to item 7. Thank you very much. We'll now move on to agenda item 7, which is the review of the Food Poverty Strategic Needs Assessment, JSNA, and checking which officer is responsible. Is that you again, Lloyd? Okay, Lloyd, you want to put the paper to the committee?
Thanks very much. Chair, I'm conscious we've got a busy agenda this evening, and I think between Matt's presentation and the previous conversation, and hearing from the level of detail we've had from Kate and Neil, I'm not inclined to say much on this. This has obviously come about from the Child Poverty Task and Finish Group recommendations. It was undertaken by the County Council Public Health Team on our behalf. And as well as coming up with some high-level findings, many of which Matt covered in his report, it identified 9 areas for focus. And what we've done, we've provided some information against each of those areas for focus. Some of those are very much within our gift, others less so. So I'm going to take it that members have read the paper. And the only potential area of funding that members may wish to consider tonight is the item or the item around a community fridge scheme for Worcester Community Trust. So again, I'm conscious of the conversation, needing to think closely about how we spend our £50,000. But WCT have highlighted a need for some funding to support a community fridge scheme over in the west side of the city. So I'll draw that one to members' attention. That may be one they want to consider. I think I'll take it as a read, Chair, and happy to answer any questions.
Yeah, any questions? Yeah, Councillor Matt Lamb.
Obviously, a reference there to item 3.6, and clearly, I think I speak on my behalf, and I'm sure Robin and Richard, if he was here as well, that this seems to be a proposal here in 3.6 that some of this money that we've been already discussing will be spent on supporting a community fridge and freezer, and possibly a subscription to FareShare as well, at the Green Centre on the west side of the river, and I would be fully supportive of this. We did have, Robin and I did have a discussion before the meeting, and we just wanted to ask officers, because I'm sure that we were approached by, who was it, Robin? It was
Tudorway Family Hub.
Tudorway Family Hub, and they were looking for a contribution from our COVID recovery money this year for a subscription to FareShare. So I'm just wondering whether you recall whether that was actually granted, because clearly we don't want there to be repetition of provision on the west side of the river. If that wasn't granted, we put our heads together, we couldn't quite remember whether it had done actually, then I certainly are fully supportive of the 3.6 if that is a proposal to dedicate some of this £50,000 to the establishment of a suitable fridge and freezer, community fridge and freezer at Worcester Community Trust at the Dines Green Centre.
Chair, WCT have certainly raised it with us as an area of need. Yeah, you could class it as a proposal. The other organisation and proposal that Councillor Lamb refers to, I can't recall seeing that in any of our funding spend or allocation or commitment. So I don't think it will be a duplication, but we could absolutely 100% check that for sure.
Okay. If there are any further comments on this, can I ask the committee to note the content of this particular report?
Chair, if Councillor Lamb is suggesting that we utilise that funding.
What's that?
If Councillor Lamb is suggesting that we support that area of funding.
Yeah, can I formally propose that? This
Okay, so is that a motion to this particular committee? Okay, can I have a proposal and a seconder for it, please? Can we put this to the vote? Yeah.
So, how much is it?
How much is it?
So paragraph 3.6 of the report, Chair, makes it clear that the purchase of a suitable size fridge freezer is in the region of £1,500, and there'd also be a subscription to FareShare of around £1,700 a year. So I think it'll be fair to say that we could support the capital cost and 1 year's worth of subscription, if Councillor Lamb as the proposer.
Which is the total cost of?
It's so capital £1,500, £1,700. What's that? £3,200.
Okay. So
Of which it's £50,000 less this. So yeah.
okay.
Yeah.
Okay. So can we put this to the vote, please? Thank you very much. Thank you very much for the proposal. So
perhaps we should, if I may, perhaps we should actually make sure that Christopher Whitehead know about this new initiative, because food is a major thing that they've just talked about.
Yeah. Absolutely. Yeah. Councillor Lauren.
Thank you, Chair. I'm just wondering if perhaps the schools also need this. Can we arrange perhaps for a similar scheme to be rolled out to the schools? Because it would appear if pupils are that hungry, they're leaving the school grounds to go and steal from a supermarket, we need to actually have some food available to them in the schools.
Chair, I'm not an expert in this area, but I think probably the solution for schools is slightly different, given that some of them have got existing kitchens and operations internally. But as I said a little earlier, I think there's definitely a conversation for us to pick up with schools around how we can support them, particularly given what we've just heard. So we'll certainly do that.
Yeah, and I certainly think what we've heard tonight, I think we need to not do things on the hoof immediately at this committee meeting, but actually, you know, at a future meeting, by the time we've thought of some proposals, we can practically do. Yeah, Councillor Stephen.
Taking on board your point there, this money's been around for a little while now and it hasn't been spent. At what point will we be deciding how it's going to be spent? Because it's great that we're talking about all these things, but the fact that we've had best part of £50,000 and there are people in need and we've not spent it, that needs to be spent. So I was hoping at this meeting we might have a like a menu of things that we could choose from and we'd better decide it. Disappointed a little bit that we're not going to be deciding how to spend that money. So will that happen at the next committee meeting, a proposal of how we'll spend it?
Thank you, Chair. Again, just a reminder, just around, I've not got the exact figure, but the amount of money that has been spent by this council in and around this area, it's not insignificant. Would be the first point to make. The next committee cycle is just around the corner. We are. I think it's middle of March, so we can try our very best to get something to March committee. But I wouldn't want to 100% commit. So we'll try our very best, but it may be, you know, the committee cycle after March.
Okay, thank you.
You happy with that? Okay, can we then note item 7, please, on the committee? We can. Okay, thank you very much. Okay, we'll now move on to agenda item 8, which is regarding the setting of the budget. Shane, do you want to comment on this?
Thank you, Chair. So this is the point in the cycle that we now reach for finalising our budget for this coming year, which will take place on the 7th of February at the Policy and Resources Committee. This committee is slightly different from the others in that it doesn't have specific lines within the overall budget, but has a number of pots of money which have been allocated to it for taking forward specific initiatives, and those are discussed and updated elsewhere on the agenda, so I won't dwell those on any further. We bring forward the capital allocations, Appendix 2, for interest and information to members, and the remaining additional item, I think most councillors will have been at previous committees. I'll reiterate the message, though, that the Appendix 1, our medium-term financial plan, is in a position whereby we are, following the settlement that we received from government, looking at a forecast budget gap overall of 1.8 million. I can say that the processes so far have reduced that to about 1.7. So there's still a significant demand on our reserves and an exercise to take place in the new financial year to work out ways in which we can reduce that forecast budget gap in the fullness of time. However, if there are any items that members wish to propose in terms of this coming budget, whether those are ongoing items or one-off commitments from reserves, then happy to receive those and take them forward to Policy and Resources Committee alongside the other items that we've received from the other committees.
Okay, thank you for that. Any comments from the committee? Yeah, Councillor Rio.
Thank you, Chair. Can I propose a proposal that we continue the councillor award funds that we've had and reduce them from 2,000 to 1,000 and take them out of the I mean, they've proved to be really extremely popular for all councillors in terms of that, and the excuse me, that the you know, smaller groups that aren't fully fledged organisations that haven't got access to some of the resources that bigger charities and organisations have been coming to local councillors for these, and they've proved extremely useful. And COVID is still ongoing, and there are groups and organisations that are still suffering and recovering as a result of it. And I think it would be extremely useful that an option for small community organisations to approach their local councillors to continue for another year. So I'm proposing that, if that's possible.
Through you, Chair. Councillor Riaz and Denham and myself have discussed this previously as a proposal, and there are basically two elements of it to consider. First is is the committee happy to renew the grants for £1,000 for a further year. And the second we discussed was that the Environment Committee has proposed an extension of the Environmental Sustainability Grant of £150,000 for this coming year. Last year, or the last 2 years, around £40,000 of that money had been used for small community grant activities. So part of the proposal was, if there isn't sufficient money in the budgets overall for the coming year, that proportion of that £150,000 be allocated to cover £35,000 for this. So there are two proposals. One is that we agree to have the award funds at £1,000 per year. And secondly, if Policy and Resources feels that there isn't sufficient money across the board, that actually we use some of the £150,000 environmental sustainability grant funding for that purpose. So we just need to decide whether you support both of those or one or the other. Is that clear enough what we're trying to do? Okay.
I see a lot of nods around the table there. So is therefore that a proposal that we then make a recommendation to the Policy and Resources Committee to appropriate?
The first one, do you need an approval?
It is,
and a
yes.
seconder?
What?
You need to second that as well.
Okay. Okay. Lord Mahan, seconder, Robin Norfolk, yeah, that's fine, yeah, that's okay. Two pieces of matter.
Okay. So
it's just for the benefit. It's just for the benefit of the minutes. That's all, for the minute taker. So, can we have hands, please, for that proposal?
This is the first one. Yeah?
Okay. Right. Okay.
Any objections?
No objection. That's great. So, in that case, then, are we happy that we've noted this report now, and we've considered the priorities, and we've
So
made our recommendation?
We need the second recommendation as well.
The second recommendation, okay.
That the funding be drawn from the Environmental Sustainability Fund.
Okay.
Okay, I'll put that to the committee.
Okay, then we put that again. Okay, Lucy and Karen for this one. Okay. Now, can we have yeah. Okay, that's great.
5, 6, 7, 8.
Okay.
4. Any objections?
No objections. No.
Any abstentions?
One abstention. Okay. One abstention from Councillor Louis Stephen. Okay, if we're now happy with this particular item, can we move the agenda on to item 9? Okay, thank you. Okay, item number 9 now, which is the Town Investment Active Travel Project Update, which is an interesting one. So David Sutton. I'm really struggling even with this.
Thank you, Chair. The report before you members is, I think, fairly self-explanatory. Covers the town investment plan, one of the 5 projects within the town investment plan, which is the active travel project. And you'll see there's a number of elements to that. Number of active travel corridors, new and improved cycling and walking routes through the city, contribution to the Kipax Bridge, and also some information on a proposed bike share scheme, bike hire, bike share scheme, which we're looking to open next spring in 2024. So the first section sort of outlines those projects. Going to section 3, the information within the report. So just to inform members, there's an officer project board chaired by Shane, Corporate Director of Resources, and project boards and teams across city and county council staff report up to that board. That's how it's managed. And then, of course, this particular project reports to this committee. Also related to active travel, you will have seen reported recently, there's an active travel element to the Shrub Hill project, which is a route that runs from the rear of Asda up to Shrub Hill Station. That goes through PED committee, so that will be reported separately to this selection of projects here. So looking at the active travel corridors, there's 3 elements there. There's Diglis to Carrington Bridge and St Peters. That's some work through Cherry Orchard Nature Reserve, which will make that more accessible. And then also taking the active travel and cycling route up through St Peters, and then onward then to Norton and to Kemsey and to Carrington Bridge. Some extensive routes around Ronkswood, going both sides of Ronkswood Hill, that will link Ronkswood community with the community centre, with the hospital, with County Hall, and then onward up actually to the Lippards. And then the work that's most advanced that members may have seen is widening and surfacing of the canal towpath, which will extend that sealed surface all the way, actually from Diglis here, that will extend all the way right up to Six Ways Stadium, past the Blackpool Trading Estate. And that's on site and due to be completed in the summer. Work's progressing well there. And we will then have a look to see whether, if the budget allows it, you'll be aware construction inflation pressures are pretty high at the moment. If the budget allows it, we'll be looking at some further works around widening and removal of barriers and signage further down the canal towpath. These works are all being delivered by the County Council. The assets that they're working on will be County Council or Canal and Rivers Trust largely. So we are the funder through the Towns Fund here, but they are works to highways largely, more Canal and River Trust and existing paths. So moving on to the Kippax Bridge, which, as you know, is a major County Council project. And that's the new bridge. I'm sure members are very familiar with the detail of that, from Gulliver Park across to Kippax Park. An indicative programme to that is that the bridge will open during 2024. I think there's been some flooding recently on the site, but I don't think that's delayed the programme unduly. So 3.17, then some detail around the bike share scheme. We're an early stage on this. The intention for the bike share scheme is there'll be bikes for hire. You will be able to hire located around the city. There's a scheme operating very successfully in Hereford, is probably the nearest one to us. Also up towards Birmingham, the West Midlands, there's a wider scheme over quite a large area there. So the type of scheme would be you'd be able to book on hire a bike by the minute, by an app, ride between one destination and another, off hire the bike, leaving it at a particular location. And then when you perhaps had a look around the cathedral or wherever you've been to, or if you've been at school all day, for instance, or at college, you then be able to come out and pick up a bike again for your journey on to the next location, or back home at the end of the day. We're in an early stage of procurement here, and there's not a lot of detail. You'll see exactly how this scheme will look within the report. And the reason for that is the key to these schemes, feasibility studies have told us, is that it's really the operator. So there'll be the private sector, third sector operator running the scheme for us. It's all in the procurement really of this scheme. So it's sitting down with the operator and finding a scheme that will be sustainable, that will work for them, that will allow them to operate as a business, and then it will be sustainable for many years. So we will come back through the procurement stage with more detail about that scheme. This is just the initial programme really. I'm giving you here some headlines of how we envisage the scheme to look. We think probably between 100 and 200 bikes, with maybe a third of those being e-bikes, and looking for locations all over the city. Clearly that's, when we come to do that, there'll be a lot of ward member engagement about particular locations. The model we're looking at, they will be geo-fenced locations, so there's no docking station as such. They're GPS tracked, and users are required to put them within a marked area and return them to that. And I think it's managed with a small fine if they're not put back in the right area. So originally we were also looking at including large city centre cycle storage and parking. So originally we thought probably the cycle scheme would operate on the edge of the city centre and we could incorporate cycle parking with that. Having looked at a number of schemes that are running, it seems it's not that common, and they're more likely to be in a lower cost premises further from the city centre, which obviously makes the cycle parking less likely to fit with that model as well. Since we drafted the original business plan, you'll be aware that Crowngate are operating a cycle parking facility that's very popular and working very well. We've been talking to the centre manager there about how we can support that and perhaps encourage them to expand. So that's a model we will look at. And as the procurement of the bike hire scheme progresses, we will look to see what we can do around the bike parking for the city centre. But that will be something for the coming months. So as I said, we look for procure over the summer and then launch in the spring of 2024. At Appendix A, there are a lot of maps of detail of the active travel corridors. And what they will also show is the context within the existing network and infrastructure of how everything fits together. So we've got a considerable investment going into this, but you'll appreciate in the scheme of the entire highways infrastructure, the active travel infrastructure, it's a relatively minor amount, but some important additions that will bring a real benefit. That, Chair, I'm happy to take any questions.
Yeah, we've got quite a few questions. I'm just writing some of them down now. What I want to propose we do is we actually take the questions in two groups, right? So the first questions will relate to the cycle routes and the Keepack Bridge and that. And then the second set of questions will be about the cycle scheme. And I think that way it's probably easier to sort of manage the discussion. So first of all, questions on the cycle route. So is yours question on that, Lucy?
Thank you, and thank you. I just want to ask a couple of questions about the Runxwood. I'd like it to actually be relabelled Runxwood and Warndon villages, because it isn't just Runxwood. It is actually quite a large, there's a Pelican Crossing and a cycle route all the way from the hospital to Lippards. So, and it's very, very welcome indeed. So I would just like it to be renamed.
Yeah, noted. A good point, Councillor Hodgson. Yeah. It's a shorthand project name that we're using within the team, but yeah, points noted.
Okay, Councillor Louis Stephen.
This may be a slightly parochial question, but the improved cycle route from the Digley's Footbridge up into St Peter's, it involves an improved road crossing across the Bath Road, across between Barnshaw Avenue and Norton Road. What sort of crossing is that going to be?
So I think I'd probably need my highways colleagues here to give the actual animal, the bird that it's described as. It will be a controlled crossing.
So
I'm
with
told
lights.
it'll be a controlled crossing with lights. Yes.
Good.
Yeah. Traffic will be required to stop.
Good.
Thank you very much. Yeah, about the Capex Bridge, I know the Capex Bridge is a controversial issue with some. I'm a real supporter of it, to be honest with you, because I think it will really open up the west side and give us access to the north east side of the city, which I think is very, very welcome. The only thing I'm slightly concerned about, when you actually look at the crossing, you know, a new access path across the Capex site, linking the new bridge to Hallow Road. Yeah, I can see that. And then providing pedestrian cycle routes from the bridge to the national cycle route down through Pitchcroft. I think the missing bit here is between the bridge and the west side of the river, which cuts between Capex Bridge and at the bottom of the Wheatsheaf pub, because that stretch, because when you actually look at the natural movement, if I was going to cycle from where I live in St John's and I wanted to take advantage of the Capex Bridge, what the natural movement is not up toward Riverside close and then right down past the municipal recycling centre. It will be down Hollywell Hill. And if you look at where most of the population lives in the west side of the river, it would naturally funnel along the riverside, under the Wheatsheaf pub, along the west side of the river, and then hit the Capax Bridge there. And the trouble is, that area of the riverside, when it's wet, it's not a paved road, it's not a paved path. It sort of 6 months of the year, that's going to be very, very difficult to travel along with a bicycle, for example. So I think that's a real missing link, actually, is some kind of paved pathway between the Wheatsheaf pub and the staircase that goes up on the left-hand side just past it and the bridge. I think there's a real sort of missed opportunity there. And I think, can we have some assurance that even if it's not done in the very first sort of iteration of this, it's going to be added to at a later point?
Thank you, Councillor Lamb. And you make a really good point. The original business case that we brought to P&R, the aspiration was that would be a loop. So that's between the Capax Bridge and Ferry Bank, the Ferry Bank stamps that you're talking about. I mean, members would be aware of the inflationary pressures that are around. I think the price of steel is particularly one that's put a lot of pressure on this project. Our contribution to this is capped at the Towns Fund funding. So, city and the other funding that the council previously identified. So I think around 900,000 previously, and then 2.5 million for the Towns Fund. The other complication is there's a fair bit of work because there's private land and property down there. So I was talking to the project manager this afternoon about this issue because I thought members would raise it. So there are some complications there, but not complications that can't be overcome over a period of time. I think as much as a sort of reassurances I can give you is that it is the aspiration of that project team to complete that. But the current focus is on getting the bridge across from Capax to Gullivel, and that will have to be revisited in the future.
Yeah, thank you very much for that question. I know I used to live on Henwick Road. I used to live next to the Wheatsheaf pub, and a lot of that land down those gardens do get flooded quite easily, and there is actually private land there with private mooring. So yes, it wouldn't be easy to put a path down there, but I do agree it would be great to have one. So the next one is Councillor Pat Hagar.
Thank you, Chair. Two things really. I'd like to start with Ronkswood, and there is a fairly direct route between Newtown Road and Tolladine Road through the woods. And there is a signalised crossing across Newtown Road at that point, so it's pretty okay. But that route through the woods, which is really quite well used, rather than going along the main link road there, is kind of, well, it's a bit of a mess really. The lighting isn't great, and the surface is terrible. It really is a bad surface. So if anything could be done about that surface, that would be helpful. But I also think that we need a lot more low-level lighting, so it doesn't actually disturb the bats, but it does give people a fighting chance of seeing where they're going because on winter afternoons and so forth, or winter mornings. So that's one thing. The other thing is thinking about the bike share issue. I think, yeah, Santander has form for actually contributing to bike share schemes, particularly electrical ones. And I was thinking we could look for partners, perhaps, in the banking community and others. And I'm reliably informed by Councillor Louise Stephen that electric bikes are terrific. I don't ride one myself yet. I think I'm thinking about it. But one of the problems of encouraging people to ride bikes in the city is we have a lot of big hills going away from the river valley. And I think that puts people off. So if we were looking at electric bikes quite a bit, that would be quite useful, I think. Might encourage more people to
on a separate,
get out,
separate topic after this,
Yeah.
but you can take this particular question. There should be more questions
Thank
on
you,
the
Chair.
bike.
Thank you, Councillor Hagar. I think probably best that we speak about the individual pathways outside of the meeting, and we can, after the meeting,
that would be helpful.
Look at the plans and see exactly which location you're referring to. And lighting is something that other members have mentioned to me about a number of the routes. Our scheme at the moment is not for lighting. You imagine the cost of that over the length of 10, 11 kilometres that we're putting in here. would be extremely large. So we're focusing on the surfacing on those particular areas. But again, yeah, good point. I understand the point you're making. Thank you.
Okay, James Stanley, and then I've got Karen Lauren.
Chair, thank you. David, in the paragraph Rongswood, you make reference to final details of route being finalised, number of land ownership issues to be worked through. Is there any complication there that might give cause for concern, and would it dramatically impact on timescales or costings?
There's one small area that we're talking to a landowner. At the moment, I'm not going to share those details in the committee. It won't be fundamentally, it won't be fatal to the success of the scheme. It'll just require a small diversion.
Thank you, and Karen Lauren.
Thank you, Chair. My question is about Pitchcroft, which I believe the city owns. A lot of people use that road with the pathway for cycling and walking, and that's been getting increasingly dodgy to cycle on. I certainly wouldn't attempt it in anything but very good light. So I don't know if there's any part of the scheme, anything could be spared to pay any attention to improving that.
I think that's not within this scheme. I think that would be within the council's normal maintenance. If there is anything spare at the end of this project, then certainly we could look at that, but can't give any assurances at the moment.
Right, if there's no further, you've got about bikes?
Just, it is about bikes. Well, it's about the cycle routes, not necessarily about bikes. These cycle routes are going to be shared by multiple community groups. I am slightly concerned, and I think I've expressed this before, I'm slightly concerned about conflicts between the three groups that I can identify. So I'm talking about pedestrians, the Cherry, I've forgotten the name for it now, and the Diglis to Six Ways are going to form part of the Wild About Worcester Way. The work in these will make those paths more accessible to disabled users. And then of course we've got cyclists. Not all three of those groups of people, or not all members of those three groups of people, are necessarily the best behaved in the world, no matter what kind of wishes we would like to give to them. So I am, as I say, just slightly concerned about a clash between those members of the community, and I fully accept that we would look for those members to be sensible and to be civil with each other. But you know, just trying to express my concern.
Thank you, Councillor. I think that's noted. It is something that we've been aware of in the city. Bromwich Parade. There's a number of signs up that the county council have put up there. The Share with Care motto is, I think, something that started on Canal and River Trust land, actually. So it is a thing for canal towpaths, because the ability to widen a canal towpath is normally quite limited, just because of the topography of the land. I think the majority of people do share with care. I would just hope that a few more would do so.
Thank you, Chair. You missed the users of static fishermen. I do see quite a lot of moaning about, and dog walkers, loose dogs.
Okay, that questions on the actual routes and that. I know Councillor Pat Ergar mentioned about the bicycle rental scheme, and specifically about the sponsorship ideas, but what Santander do that. Have you investigated those as part of your thing? Now I'll ask Councillor Stephen to come in.
We did do a sort of a feasibility study around this before we published the business case, and there have been some examples of sponsorship. Santander was the quite high profile one. They're not particularly common, but if we could secure a partner to help us, absolutely we will do. So we won't rule that out. And your point about e-bikes is very well made indeed.
Councillor Stephen.
I'm really encouraged by what you're saying about the bike sharing scheme. I think one of the biggest barriers to active travel is not only about the surfaces, but it's also about storage of bikes. And I'm thinking particularly in areas that low income areas where you're talking about social housing, terrace housing. We go into an awful lot of properties, perhaps platform properties or whatever, and you see bikes all over the place, and they're not really allowed to store them in those sorts of locations. And it is a massive barrier to many, many people to be able to store their bikes. I'm hopeful that the bike hire scheme will work, and if it does, that'd be absolutely fantastic. But if it doesn't, could the council please have a backup plan? And a backup plan could be that we invest a similar amount of money into cycle storage schemes around in Cathedral Ward, in Gorse Hill and in Warndon, and lots of areas where we do need to encourage more cycling, where bike storage facilities are really desperately needed for people to be able to use, to take part in active travel. So I think it's vitally important. It's one of the big enablers for active travel.
And actually, that's something that the sustainability team have been looking at outside of this project, the potential for secure cycle storage, potentially a very large project and a very costly project, but maybe working with social landlords as well. So that's something that's being pursued. Just on your point, Councillor, about sort of a backup project for this one, this is the project that was approved by Policy and Resources Committee, supported by the Town Board, and the business case accepted by government. I'm confident this scheme is going to work. Just to know, if we were to wish to put another project forward, that would require government support and potentially put the funding at risk. But I think it would be a last resort for us, because we're committed to the bike share project.
Thank you very much. If there's no more questions on this, can I ask the committee to note the content of this report, please? Okay. Thank you very much. Thank you very much, David Sutton, for that update on this active travel project. I'll now ask Tom Mountford to come to the about the discretionary welfare. Oh, I'm sorry, you're doing it, Rosie. Yeah, sorry about that. Yeah. Okay, I know you've been very patiently sitting through all this items, so I'll ask you to present the report.
Thank you. Good evening, everyone. This is a report on the Worcester City Discretionary Welfare Assistance Scheme, which I will refer to as DWAS from now on for ease. And just noting that responsibility for this scheme has recently moved to the Health and Wellbeing Committee from Communities Committee. And so this report has gone into the background of the scheme to bring members up to date on where it's been over the years, up to the current time, which is a core scheme which is funded entirely from the City Council based budget, with enhancements utilising hardship funding, at the moment the household support funding, to improve access and availability of the scheme. So the fundamental basics of the scheme are to provide support and assistance to Worcester residents who are considered to be vulnerable and experiencing financial hardship. And the key areas that we are assisting them in through the scheme are through the provision of white goods, through food vouchers, energy vouchers, and with the addition of the hardship funding, we also have other essential items that we can provide through the scheme. That particular element of the scheme isn't prescriptive in what we can provide. We're looking at the individual circumstances of families. It was very interesting to hear what the schools were saying in terms of the need that they're seeing. You know, we have provided school uniform through the scheme. We've provided winter clothing and children's winter coats through the scheme as well. So it's really interesting to see that they're also experiencing that. So the scheme does have a number of eligibility criteria to access it. I won't go into detail on those. They are included in the background report. But what I do want to say is that although those eligibility criteria are obviously considered the D in DWAS does stand for discretionary, and so we will always take into account individual circumstances of applicants. If a referring agency feels that a household doesn't necessarily meet the strict criteria but are in need, are experiencing financial hardship, then we have the discretion to be able to make awards where that's needed. So looking at the performance of the scheme, you can see that the demand on the scheme over the last few years has increased significantly, probably unsurprisingly given the times we're living in and the cost of living issues that we're seeing. And looking at the demand on the scheme for this year so far, bearing in mind we're in January now, nearly in February, we're looking at over 900 applications to the core scheme alone. So just to note, that isn't taking into account the additional applications that we're seeing as part of hardship funding. Just the core scheme is seeing a significant increase. You can see from table 4.1 that the vast majority of awards are made through the white goods element of the scheme, and unsurprisingly the vast majority of budget is therefore spent on the white goods element of the scheme, because those items are obviously far more costly than the energy vouchers. I think it's around 80% of the budget is currently spent on white goods. Table 4.2, you can see that the range of households that we're assisting through the scheme, and just to note that households can fall into more than one of these priority groups. So you'll see that the majority, the largest proportion is for households with children, but you'll often find that actually they may also be experiencing homelessness, they may also have health or mental health issues as well. So there are a number of categories that we're assisting. So as I mentioned, the hardship funding, we've been awarded since November 2020, a number of different tranches of funding, currently the Household Support Fund. And since that time, over 750 households have been assisted through that funding. And as I said, that scheme is providing enhancements to the type of goods that we can provide, specifically around the white goods. Is also increased the number of vouchers that we can provide to households in a 12-month period. And we've also recently increased the value of the energy vouchers that we're providing, given the significant rise in the cost of energy that we're facing at the moment. And I've just given some examples at 4.6 of the type of assistance that we've provided through the Essential Items Fund. Again, as I say, not prescriptive, very much looking at what that particular household needs, what their circumstances are, what's essential for one household might not be essential for another, and so on. Looking at the financial information, you can see that the core scheme has a set budget each year from the council base budget, which does increase in line with inflation. And up to April 2023, we will have received £200,000 of hardship funding into the scheme as well. And again, you'll see that the majority of that has been spent on white goods enhancements, but we've also been able to utilise it for provision of carpets through the scheme on health and safety grounds. So members will probably be aware that in social housing properties, much of the time they are let without floor coverings, and not only can that affect the health and safety of the house, but also increases the cost of heating that home. And there has been a gap in provision of that particular service in the city due to issues that I've mentioned here. So we're very pleased to be working with municipal charities to be able to provide that to, unfortunately, a small proportion of households, but where it's felt that on health and safety grounds that's essential. We've also worked with Armchair to fund their service to assist households with essential items of furniture. I'm sure are aware that Armchair are a charity who receive donations of good quality second-hand furniture and sell them to vulnerable households at a low price. So I think, having heard all the things that we've heard tonight, and the fact that the scheme hasn't been reviewed significantly, I should say, since 2017, it's the right time to undertake a review of the scheme to ensure that it's still meeting the essential needs of Worcester residents, that it's still targeting the right people, it's still providing the right services. So the report is proposing that we undertake a review of the scheme, and that will look at not only, so we want to undertake consultation with stakeholders and our referring agencies to understand their experience of accessing the scheme, how they feel that the administrative processes work, but also the type of support that's available through the scheme, whether they feel the balance is right between the type of goods we provide. It's interesting, again, hearing the schools. I looked through all of our referring agencies before tonight, and I don't think we had, schools were certainly conspicuous by their absence, so it's not something that we're currently assisting them with, and whether that's because those households are going to other agencies to access the scheme, or whether that's a gap there that we need to address. So that's something I will take away from this evening. We'll also look at good practice elsewhere to see whether there's anything that we can learn from other areas, whether there are other types of goods that we could provide through the scheme, and also look at the mapping of services in the city. So again, members will be aware that as a result of COVID and as a result of the cost of living crisis, there's been a number of additional hardship funding from government, and nationally and locally other schemes have sprung up to support communities. So we want to ensure that we're not duplicating that effort, and that we are identifying where there may be gaps in need so that we can plug those gaps. So I think I'll leave that there. I think that's covered the majority of it. If anyone has any questions, I'm happy to.
Thank you very much for that synopsis of what the discretionary welfare assistance scheme does. The first hand I see is from Councillor Stevens, so I'll ask him. Then Councillor Lucy Hodgson, then Pat Hagar. So Louis.
Thank you very much for that, and it's a very interesting report. I was wondering, there's a number of categories of things that the DWAS scheme can pay for, and I know that one of the things that you do provide money for is for essential spend for things like perhaps repair of a front door where the letterbox isn't working, or draft excluding. I know that does happen, but it's obviously a discretionary thing. And maybe some people don't know that they can get money for that sort of item. Obviously, from a fuel poverty point of view, if you've got a problem with the letterbox, or there's a draft coming in, it can make a massive difference to the heating of the home and have a big effect to a family. I'm just wondering whether, in terms of presentation, whether if you have a table in the future, whether it's possible to put that as an explicit thing that people can claim for, because then it would help people who are referring in to know that they can get help with that sort of expenditure. Just a suggestion.
Apologies, I'd like to take credit for that, but that's not actually something that's available through our scheme. I don't know whether that might be an Act on Energy scheme or something that's...
This is from, I was told this by the Citizens Advice Bureau. They said that it was possible to do this, and I discussed this with Worcester Municipal Charities, that this was a way that you could get small amounts of money for very small energy efficiency things. So this sort of underlines my point that it's not been explicit so far.
Chair, I can't remember what committee it was last week. There's too many committees, isn't there, for officers to do. But a member at one of those committees raised a piece of work that they were doing with housing associations around supporting these types of measures. Yeah. Thank you very much. And therefore, what we intend to do is to see how that scheme rolls out. And if there's good uptake, that may be something that we look to roll out to owner-occupiers, stroke private rented sector tenants, and perhaps the council look to purchase a small amount of material to fund that. So there is some work sort of ongoing, and that may fit very nicely into the DWAS scheme.
Can I just, I think Tom Matford was aware of this. So, Tom, were you aware of this as being an idea that, I mean, I think when we've discussed it, it was something that was available through DWAS. Is that not the case then?
No, it's not been through DWAT. It's been, it has just been directed to the RP in the city. Okay. And I think the legal consistency advice is that that's where it can be distributed.
Okay. Right. Okay.
Warwick, do you want to add?
Yeah, so County Council Public Health colleagues have contacted us around a warm box element, which would have various items in it which will help with home efficiency that could be distributed through our VCS partners. So there'll be a sort of a storage element to it to be able to distribute these sort of warm boxes out. So we're just working with County to see how that would work and what would be in them, and so whether the County bought all the equipment and literally delivered it as boxes, pre-made boxes for collection, or whether one or two charities might want to act as distribution centres for other smaller charities. It's all in working development because there's obviously some there's pros and cons to be out all the different ways and making sure the right people receive the important products, but certainly that's something County are keen to distribute across all the districts across the county. So we're just sort of seeing how it would work for Worcester.
Thank you, Councillor Lucy Hodgson.
Thank you. We talked earlier on today about pupils and schools and that sort of thing. And one of the things that the BBC did a project on was about beds for children. And I don't know whether or not you could include in particularly armchair the fact that mattresses can be cleaned and distributed and that sort of thing, and whether or not you could perhaps include in this sort of scheme mattresses for children.
Yeah, thank you. I think that was Leeds area, wasn't it? I think I saw the same report, and that did have a conversation the next day with a colleague about doing some research into that, because that's it. You know, obviously, it was shocking to see the number of children that didn't have a bed or were sleeping on, you know, the mattress on the floor, and obviously that has much wider implications for their health, education, and so on. So yeah, certainly we can look at that as part of the review. Thank you.
Councillor Patega, followed by Councillor Jabaria.
Thank you. I'd just like to advertise a scheme that is run by my Rotary Club, Worcester Rotary, called the Sawyer Trust. It is nationwide, but we administer it. And it is a kind of old-fashioned scheme because it's for ladies over 50 years old, and the criterion is in need. So there is a confidential chat that the club's officer has with the person about what the need is and what their circumstances are. But it's usually very informal. It's not, it's not onerous or anything like that. And they customarily purchase items such as, they actually do the purchasing, such as white goods, fridges, stuff like that, cookers. And also they've purchased beds and other items as well. So if you do know of a lady over 50 who is in need and that might fit the criteria, I'm sure they'd be happy to hear from her. Sian actually has the details. I gave Sian the details, but if you need them, do email me and I'll send them on.
Thank you for that. Councillor Riaz.
Yeah, thank you, Chair. Thank you, Rosie, for the report as well. I mean, since I think its inception in 2016, I think it was our former colleague Roger Berry, I think, who was instrumental in administrating this scheme. It's proved a really, really useful scheme for the residents of Worcester to access. I was just really curious to understand why the decline of take-up has taken place. I don't think that the review should focus around whether the scheme is needed at all. It's just how we access it, and obviously where accesses it and why people aren't accessing it, and what we can do to improve that, and what people can actually access it for. And that might mean through the review that we widen it to the scope that other council officers have suggested in terms of including those. And that's and even more so in under the current circumstances of the cost of living crisis. I'm sure that with improved transparency, that take-up will increase. I think one minor suggestion would be under the recommendations that whether it could be delegated to the officers with recourse to the chair and vice chair of this committee upon review.
That is an option. I think we've always considered it necessary to bring any sort of policy change, I suppose, back to members for a decision. But I think it's a reasonable proposal put forward by Councillor Riaz, and one that he may wish to formally propose. See if there's any support for it.
Can I formally propose that then, please?
Seconder, please. Thank you. Thank you very much. Any against or any abstentions? No, we haven't. That's okay. That's carried and that's taken forward. If we've got no other matters on the DWAS scheme, I'd like to thank Rosie for her patience listening through all our discussion. I think this is the longest ever meeting we've had of this particular committee, and actually what it demonstrates is how this committee is now coming into its own in terms of the City Council's group of committees it has. So thank you very much for your contribution. And I will move on to the final item, which is our Q3 performance report. So has anybody got any issues on this? Questions?
That's fine. Thank you, Chair. Just to introduce, this is the latest Q3 performance report for the committee, and if any members have any comments, we'd be happy to receive them. Thank you.
Yeah, Councillor Lewis Hodgson, then Councillor Steve Cooker. Yeah.
Mine's just a sort of housekeeping thing. When in PED, where we have a policy, a project or an action that is partly completed and partly isn't completed, we have like a green dot, a green sort of circle with a red dot inside it to show that some of the items are concluded, but others aren't.
Through you, Chair, that's automatically generated through the system. So if it doesn't have any of those little red dots on it, then we can take it that each of the individual tasks underlining the project have been completed in time.
We've just, I'm thinking, implement the child poverty action task finish. Part of it was actually complete.
Yeah, so through you, Chair, it only works one way round. So if it's green, which suggests that overall the project is on track, but one of the tasks or more isn't done, then you'll get a little red dot. But if overall it's not being implemented, then it's red. Okay. So in this case, it's just a red.
Thank you.
Okay, Councillor Steve Cooker.
Thank you, Chair. Yes, so my question really is on these key performance indicators is that I would assume that they would be looking at or measuring outcomes that the City Council has either an influence over the implementation of, the funding of, or influences. It's not immediately obvious to me the last two key performance indicators, so the number of disabled people living independently through home adaptations and the number of exercise by prescription referrals, in what way the City Council has any influence or implementation role or funding role for those two indicators.
So the first, Chair, around independent living, the council spends £650,000 a year on disabled facilities grant work. So that's our role in respect of allowing people to come home from hospital and get them back into accommodation, or keeping people in their own homes. And that's a piece of work carried out by each of the district councils across the county. The second one is less of a role for us, but in respect of the Diabetes Unlocked project, one part of that is access to leisure through our public leisure centres and sports centres. So that's why we've included that one in respect of this performance scorecard. I tend to agree with Councillor Cochrane. It's slightly, wider than what we would normally look to put in, but I think because this was a new committee, and we were looking for the most relevant projects we could find at that point, we felt it was a good example of what work we were involved with as a council, albeit not necessarily 100% responsible for.
Just to follow on from that, if I may, Chair, so is there then a process for reviewing what the key performance indicators are that would come to this committee?
So at our March committee, the committee will receive a report on what we are proposing for next year, and members will have a chance to debate that and agree, disagree, or recommend any indicators that we've not put forward as officers.
Okay, any further questions? If there's not, I'd like to thank Shane for delivering that. And apologies for missing out. I was looking at this bottom and I saw Joe Payne. Oh, she's here today. So, yes. So thank you very much for doing that. And I think that concludes most of the bids for tonight. Is there any other business? Anybody want to? If there's not, I'd like to thank the committee for their attendance tonight and for completing this agenda by 9:25. So have a good evening. Thank you.